Ay, 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 ugayam.
Situated just along the heart of the summer capital of the Philippines, the Baguio General Hospital and Medical Center has grown into an important institution not only in the locality it serves, but also in the neighboring communities in northern and central Luzon.
In keeping with its vision and mission statements, BGHMC strategically thrusts towards equipping itself as the leader of service delivery network for health and patient-centered care, health education, and promotion. Currently, BGHMC is a Level 3 ISO-certified PhilHealth accredited hospital with an 800-bed capacity. Under the newly promulgated Universal Health Care Law, this institution will be considered the apex hospital in the North, with its progressive developments in infrastructure and multi-specialty healthcare service delivery.
The Department of Surgery was first accredited by the Philippine Society of General Surgeons in 1989 and had maintained its status until its last accreditation in 2016.
At present, the department is composed of 3 major general surgery and trauma sections and 5 subspecialty sections.
Through the years, BGHMC has put a prime on quality training of healthcare professionals and has established a dedicated professional education, training, and research office. It is regarded as a premier teaching institution for 13 accredited medical services. As a specialty center on the rise, it now offers several diagnostic and therapeutic services under nuclear medicine, as well as under its state-of-the-art catheterization laboratory. The outpatient department is a 6-story building with floor allotments to different clinical specialties. A fully equipped minor operating room is also available within the building. The emergency room has a 24-bed capacity and has a trauma bay designed for minor emergent surgical procedures. The operating room complex is composed of 11 theaters with rooms allotted for emergency, neurosurgical, and minimally invasive procedures. Adjacent to the OR complex is the post-anesthesia care unit where dedicated nurses are assigned for post-operative care.
A 6-bed surgical ICU is also available for patients requiring close monitoring, as well as a unit for the care of burn patients. Furthermore, the surgical ward has a total of 79 beds for service patients' use, but decreased to 40% due to the pandemic. The Juan A. Flavier building has been converted into a COVID facility equipped with its own emergency room, ward, and operating complex.
BGHMC offers a wide array of laboratory services for hematologic, serologic, biochemical, and microbiological examinations. A blood bank is also within the vicinity, which is able to store a maximum of 600 bags. The anatomic pathology also offers routine histopathologic and frozen sections, cell cytology, and immunohistochemistry examinations. BGHMC was able to procure 3 RT-PCR machines for COVID-19 testing of hospital staff and patients. The radiologic department also offers a myriad of diagnostic, therapeutic, and interventional procedures. The endoscopic unit is capable of catering to upper and lower gastrointestinal endoscopic procedures, ERCP, and bronchoscopy. To provide an avenue for the continuous care of cancer-ill patients, the Cancer Institute was established. The Management and Information Service has designed a system for easy internet access of laboratory and imaging results, research, and various virtual meetings and conferences. This has paved way for the convenient access of consultants, residents, and interns to various online conferences hosted by the PSGS and PCS, among others. Other modalities of access to information include textbooks and journals of surgery and its subspecialties, which are readily accessible in the department's library. An established, multidisciplinary hospital tumor board conducts meetings on a weekly basis. The Ethics Review Committee is Level 3 accredited by the Philippine Health Research Ethics Board. The department recognizes the increasing role of minimally invasive procedures in current surgical practice. There are 2 laparoscopic towers in addition to a newly procured ICG-capable machine. Moreover, an office has been dedicated for the workshops and laparoscopic skills training of residents. Annual workshops on basic suturing and hand tying are also attended by residents and surgical interns. The Department of Surgery boasts of a highly competent staff who provide support and guidance to the residents. At present, the department is comprised of 24 consultants who are bona fide fellows of the PSGS, of the PCS, or of the respective specialty societies. A training committee specifically oversees that the residents receive a holistic development during their training period. All residents of the department have undergone a rigorous application process before being accepted into the training program. Currently, there are a total of 29 trainees in this program.
The program factor for 2019 and 2020 were 4.20 and 5.53 respectively. Case requirements were met annually since 2016, but in light of the current pandemic last year, a decrease in head and neck, hernia, and trauma cases were noted. Residents are regularly evaluated through periodic written and oral examinations. Basic knowledge, technical skills, and clinical and attitudinal competencies are likewise assessed throughout their training using the prescribed tools by the PSGS. Residents are also required to take the annual CERES and RITE. The department has always strived for excellence and has put great emphasis on the improvement of its training program through various academic activities. Section audits, morbidity and mortality conferences, lectures and case presentations are conducted monthly. Departmental and inter-hospital journal clubs, where clinical appraisal of scientific papers are done quarterly. Linkages are maintained between graduates, and they are encouraged to pursue further surgical education. Currently, 3 graduates are conferred diplomates, and 4 have passed the written examinations.
Annual research and interesting case presentations are made within the department. Various papers have been presented in different interdepartmental, inter-hospital, and national forums, garnering places and recognition in these fora. The Department of Surgery of Baguio General Hospital and Medical Center is proud of its pursuit of excellence, but more importantly, it is proud of the ethical, professional, and capable healers it gives back to the community it serves. Iyaman ya't matago-tago tako am in.